Good evening. My name is Bob Liff, and this is the CUNY Forum, a monthly town meeting that brings prominent New Yorkers together with faculty and students of the Edward T. Rogowsky Internship Program in Government and Public Affairs. We're here to talk about the legalization of recreational marijuana, and I promised myself I would try to do it with no jokes, except to say, as a man of a certain age, those who remember the 1960s really weren't there. While the federal government identifies marijuana as a Schedule I drug, the most serious level under criminal statutes, states across the country have been legalizing first for medical uses, starting in the 1990s on the West Coast. As far as recreational use, Oregon started the process in 1973 with a decriminalization statute, reducing penalties for possession of a small amount to a $100 fine, followed by many states, including New York, in 1977. Colorado and Washington started the current trend towards full legalization of recreational marijuana with statewide referenda in 2012, and states across the country, including our neighboring states of Massachusetts and Vermont, followed suit. Now both New York and New Jersey appear poised to join the rush to legalize, with measures before their respective state legislatures under consideration. And the idea of legalizing recreational use of marijuana has become so relatively mainstream so quickly, with polls showing large majorities in favor, that the debate has become embroiled in questions of racial and ethnic equity, where state tax revenue will go, where the communities of color that have borne the overwhelming brunt of criminal enforcement in the past should have first call for licenses to sell marijuana, and where the past convictions for possession should be expunged. There are certainly opponents of legalization, including the federal government, some in the drug treatment community, a coalition of New York police unions, some religious leaders, and even former Mayor Mike Bloomberg, who called it the stupidest idea he has ever heard, even though he admitted he smoked pot as a younger man and liked it. It seems that the dominant opinion, however, is that legalizing recreational marijuana is an issue whose time has come, one that will leave us with health and social issues, but remove, for the most part, the criminal enterprises that have fueled crime across the city. We're here with four New Yorkers who have looked at this issue from a variety of perspectives to discuss whether and how New York should proceed. Dahlia Heller is an adjunct professor in the CUNY Graduate School of Public Health and Health Policy and a former assistant commissioner for drug and alcohol use for the City Health Department. Chris Policano is former director of communications for Phoenix House. Vanessa Gibson is a city councilwoman representing a number of West Bronx neighborhoods and is former chair of the Public Safety Committee. And Rebecca Lewis is a reporter at City and State who has covered this issue from every angle and can tell us what it all means. Dahlia, let me start with you. You've been in a policy position on this issue. Kind of set up the debate. I mean, you have health issues, you have economic issues, you have treatment issues. Why now? Why so quickly a change?
Why now? I think, I can't really speak for what's happened in this sort of movement across the country, but I would say that it seems that as there's been some reckoning finally, I think with our history, the sort of mass criminalization and the impact of mass criminalization, there has been, and with the sort of in the wake of medical marijuana laws, there's an opportunity that people have seized on, I think, to move towards legalization of what is perceived to be, in the sort of, colloquial terms, a softer drug. I think from a public health perspective, we view this as an opportunity really to talk about public health and cannabis use in a way that is meaningful, that you can't do when a drug is not regulated, when it's not on the legal market. So if we think about public health as an opportunity to protect the public, this is an opportunity really now to engage in regulation that could be protective. Pricing, for example, we know that price impacts consumption, so thinking about how we influence pricing with taxation, for example, minimum pricing, availability. So where is cannabis going to be sold? How is it going to be sold? Who's going to govern that? How is that going to be regulated? Are there going to be per capita, rates for how many outlets can be in an area based on the residents in that area? And then third, marketing, which I think is really important, and we've heard a lot about. Our goal is, if we take lessons from alcohol and tobacco, the goal is going to be, we don't want to see youth consumption. We want to prevent youth consumption, similar to alcohol and tobacco. So marketing's a huge issue, and advertising, et cetera.
Vanessa, West Bronx is a predominantly minority community in your district. How do people look at it? I mean, on the one hand, you have the inordinately the inordinate impact of criminalization on communities of color, where usage of marijuana in particularly doesn't differ greatly across racial groupings, but it's also brought social problems.
Right.
And so, I mean, how are people looking at it?
I think it depends on who you speak to. I mean, if you talk about the younger generation, they are possibly excited at the idea of legalizing marijuana because many young people and young adults engage in it today for recreational purposes. But I think you get a different perspective when you talk to older New Yorkers and seniors that have been around for a very long time. They've lived through the crack epidemic that happened in New York City, predominantly in the Bronx. And I think it's a very complicated but yet comprehensive issue that we're talking about. And the climate is ripe for it. It's happening across the country. But I think for us in New York City, particularly in my county of the Bronx, it's compounded with the opioid crisis, with the drug use we're seeing in drug misuse, with the fact that we have a number of overdose deaths that have affected Richmond and Bronx County. And so a lot of things are happening at the same time. But I think if it is to be done, it has to be done in the right way. But I want everyone to understand that it's something that we should be talking about because of mass incarceration, marginalized communities that have felt the burden of being over-policed on many other issues like stop, question, frisk, but also marijuana was a part of that. The communities that have been impacted, that
Well,
have
stop,
been
question, and
jailed.
frisk.
Right.
They would demand that
Absolutely.
kids empty their pockets, and if they had pot,
Yes, you would get arrested.
They would get
Right,
arrested.
and
for
we've
that.
seen efforts. In 2014, the NYPD announced that they would start to decriminalize marijuana. The district attorneys were starting to get on board. But I think collectively, because New York City is so diverse of different New Yorkers, it's something that everyone is talking about, but from a different perspective.
Chris, you were at Phoenix House. I mean, that's the kind of end point for people who have abused a whole variety of drugs.
Yeah, and I should point out that I am not with Phoenix House.
You're not
now.
with Phoenix
I
House
spent
anymore.
10
You're not
years
speaking
there.
for Phoenix House. You're not speaking for your current employer.
But, and that's a little bit liberating in this conversation because, as you pointed out, the diversity is a big issue. And I think that one thing that is true after spending 10 years trying to explain substance abuse at Phoenix House was that drug policy is flawed and human. And people try to solve a problem and create another problem with their solution.
For instance, right.
Well, for instance, I mean, I remember crack cocaine very vividly. I remember the uproar about crack cocaine, and I remember people were making distinctions between crack cocaine and regular cocaine. And the result of that was exactly what happened, was this mass incarceration of predominantly brown people. And there was a tale of two cities in the cocaine crack world. But let's not kid ourselves that marijuana is a harmless drug, certainly not for young people. Right. And we're not talking about the drug specifically, we're talking about the state of intoxication. If you are intoxicated, we can get to the particular substance, but if you are intoxicated every day before you go to school, you are probably not learning very much. If you are intoxicated every day before you get into a car, you're probably going to get into trouble with the car. So, and many people, and again, at Phoenix House, you saw the tail end of this, which was what happened with someone who was, chronically intoxicated. And parents, I know this because I've seen this, parents would tell you who have had kids in trouble that the law was something that helped them get a handle on their kids. If I've heard it once, I heard it dozens of times that thank God my kid got arrested because we were able to deal with him for the first time. Treatment folks were actually talking about using the criminal justice system, but it wasn't supposed to be about locking people up. It was supposed to be about forcing folks to get to treatment. That was controversial in itself, but it turned out to be pretty effective in terms of the drug courts that were, when they were introduced, was seen as a revolutionary way to not deal with incarceration, but to be a route to treatment. And I think that as we move forward, there is not ever, the criminal justice wants to do what it does. Social workers want to do what they do. Treatment folks want to do what they do. Legislators want to legislate. And this is a really volatile thing when you start having different approaches come to this very serious problem.
Rebecca, all these problems, all these different perspectives are coming together in the legislature, wrestling with putting together a law, which is going to guide everything going forward. Tell us a little bit about what's been going on in Albany. We're taping this right after the mayor and the governor announced an agreement on MTA funding and reform, and they have congestion pricing, but they threw into the pot, if you'll pardon the expression, revenue from sale, tax revenue from marijuana. It's a little bit like the economists who predict 14 of the last 3 recessions, that you got this $300 million pot of money and people want to spend it on about $7 billion worth of priorities. I mean, give us the lay of the land on the actual debate.
Well, the governor has introduced his own proposal in his executive budget, which is kind of shaping the discussion now. Pretty extensive, but still missing, a lot of details. You can't have everything that you'd want to have in a single piece of legislation. Sometimes you got to work out the kinks as you're going, but it's not exactly, everyone doesn't agree on what's in that piece of legislation, and yet those debates are going to come out during the budget, and we already have Crystal People.
Do you think, though, by the way, that everybody agrees that legalization is an issue whose time has come and something is going to pass? I mean, something should pass?
Something will pass. It's just a matter of when, because I know the governor wants to get it done in the budget, but we have Speaker Carl Hastie who said maybe not in the budget. There's a lot to go through. Maybe we get it done a little bit later in the session. We want to do our due diligence. And Assemblywoman Crystal People-Stokes, who is the prime sponsor of the Assembly legislation, has also said, maybe we don't do it in the budget. Maybe it's its own standalone thing. There's a lot to go through. We want to do our due diligence. And, who knows whether or not that's going to happen. In the past, Cuomo has kind of, in some ways bullied his way into the budget. He's kind of often gotten his way. But with, a unified state legislature, there might be some, leverage. There might be some, wiggle room where they can say, well, maybe we don't want this in here yet. But it's kind of up in the air, because there is also there's some bad blood between Cuomo and his legislature right now for unrelated reasons.
That's shocking.
So.
Vanessa, you brought up the opioid problem in the Bronx, and I know from your work, there's the issue of the gateway. The view that marijuana was the gateway to harder drugs. Opioids kill more people in this country than guns.
Yep.
Or cars. So, I mean, is there a fear is the gateway issue a fear, or are we past that part of the debate?
No, I think there's still a real fear within the community because we've been dealing with the opioid crisis. And at first, many thought it was just an issue that was more prevalent in white communities, particularly on Staten Island with DA Mike McMahon and all of the work that they have done around, the HOPE program, which is a pre-arraignment drug diversion program, and now that's in Manhattan and other counties are looking at it. But when it hit the Bronx at the same time, we were looking at it from a different perspective. It was hitting lower income communities a lot, where we had drug treatment programs and other things to help many of the residents. And I think, the opioid crisis is something that we continuously deal with. And many don't realize, as you said, there are more people, New Yorkers, that die from opioid misuse and from drug abuse than there are homicides every year. And we have about 350 homicides a year, which is on the lower end, but there are hundreds more. Staten Island's already seen several dozen people that have died to the opioid crisis. So it is a real factor, and I think it's something that we really have to consider as we talk about this.
And I want everybody to jump in, but do people that you talk to, do they view marijuana as do they view the legalization of marijuana as a moral surrender?
The gateway drug, I understand, and again, I've been out of this world for a little bit, but the gateway drug got ridiculed, the idea of a gateway drug, that marijuana would lead to heroin. But the fact of the matter was, when you looked at a serious substance abuser and you did the history on that person, guess what? It started off with, pretty heavy usage of marijuana, which does not mean that everybody who uses marijuana is going to wind up doing heroin. But when you check out everybody who's got trouble with drugs, marijuana was in the equation at some stage of the game.
Yeah, I mean, you might want to also, I mean, again, we can't leave alcohol out of the equation,
Right.
Yes,
which
right.
is already a legal psychoactive substance, right? And I think that we go into alcohol regulation in the same way that we go into this conversation now to talk about, okay, our number one goal is prevent youth consumption. So, I mean, when you talk about these studies, the problem is, it's that science problem. It's retrospective, so it means, well, of course, this person, that was going on earlier in their life, and now they developed a substance use disorder. But yes, like you said, we have, I think there was maybe one cohort study. You would need to follow people for like 20 years, right? So they started smoking maybe or using cannabis in some form at the age of 12, 13, 14, if that's what we're talking about, and then go on to develop a substance use disorder. What proportion go on to? We don't have those studies. We don't have that data. And in large part, we don't have any data, frankly. I mean, I'd speak from a public health perspective. One of the things we love is data, public health talk, epidemiology. We like to look at what are the patterns. And then once we see the pattern, we can think about public health policy. How can we intervene to change that pattern, to reduce the problem? So we have an opportunity now to actually have rigorous monitoring of the role of cannabis consumption in hospitalizations, in emergency department visits, for example. It's been linked to first episode psychosis. We don't have good monitoring to be able to really know if that's true. Now we could actually monitor that. We could have emergency departments reporting up on that, ambulance calls.
Just one thing. Yeah. Are the same folks who do the opioid, who brought us the opioids, are they also going to be the folks who are going to be doing the marijuana?
Thank you.
Well, that's a
bringing that up.
very important question.
Corporations,
You're talking about the business
Mm.
of marijuana, the business that we've seen around the country. I mean, even the fact that because it remains a Schedule I drug, legal marijuana is a cash business. You can't use credit cards because credit cards go through a federally regulated financial system. So all of a sudden you're going to have communities awash with cash. I mean, they're awash with cash now in the illegal business, but you're not going to take the cash out of the communities. One of the things as I understand the governor's proposal and other proposals is there's a local opt-out. There are communities. There is significant opposition to legalization, and if you legalize it, allowing people are freaked out at the prospect of this business. Plus, you have the issue between the medical marijuana people who are worried about competition from the, recreational marijuana people, in part because there's a whole bunch of people who are using medical marijuana using medical marijuana prescriptions in order to get what essentially is recreational use of marijuana.
Well, the medical marijuana industry has a little bit of a leg up. They have a little bit of an advantage because right now they grow, they distribute, they sell. The same company can do all three. With recreational, under the governor's proposal, you wouldn't be able to do that to, prevent monopolies, all that. So, like, if you grow it, you can't then also have a retail store. But since all the infrastructure is there for medical marijuana industries, they would be able to. So they have, a foot in the door for that particular market. But in terms of the local opt-out, very quickly we saw municipalities say we don't want this.
But there's a lot of upstate, not mostly upstate people, or maybe I'm wrong.
Long Island, actually.
Is that
Long
right?
Island, the town of North Hempstead was the first town to opt out. I know that Suffolk County is holding debates right now about whether or not they want to opt out.
As a county.
Yeah. It
Really?
can only be towns of 100,000 or more, which is actually not too many towns. North Hempstead is one of the few that is actually large enough. That isn't, a city like Buffalo or Syracuse. Otherwise, counties can opt out. So entire counties can opt out. And I think there might be one or two more upstate, but I've seen a lot of stuff coming out of Long Island, somewhat surprisingly, especially since they just elected in a whole bunch of new Democrats, and it's kind of interesting to see.
Yeah, but Suffolk County is getting killed with opioids. I mean, the opioid problem is influencing people's thoughts about, I believe, people's thoughts about drugs across the board.
In your community.
I'm sorry, I didn't mean to
But even the
interrupt you.
political part of it, that's a good point. I mean, in order for the state Senate to become Democratic-led with Andrea Stewart-Cousins as the leader, she had to acquire a number of Senate Republican seats on Long Island. And so those members like a Monica Martinez or Anna Kaplan or Jim Cochran, they're going to be very, very careful about their support of legalizing marijuana because their counties are looking to opt out of it. That's going to be very interesting.
When you look at, one of the arguments that's been made is as a form of kind of redistributive justice or making up for past,
Reinvestment.
unequal criminal enforcement, that the business opportunity should go into those communities like yours that have been victimized by the criminal enforcement. Do you want marijuana businesses in your district?
That's a tricky question. I do think that it's an important part of the conversation because every industry we've seen, it's the corporate welfare. It's the corporations that are profiting off of this industry, like the opioid. The administration is suing a number of companies because of the crisis that we're living in today in New York because of opioid. So the pharmaceutical companies. So the question for us as a legislature is how do we want to make sure that the communities that were impacted by marijuana are now reinvested in? So when I think about that, I think about the small businesses, I think about the bodegas, possibly other, local merchants. I also think about the schools, the open space, the jobs. I mean, all of these things where communities have been marginalized for so many years, and it's time for them to feel like they should be repaid, in addition to expungement, they should be repaid for what their communities have gone through. So I think it's a conversation we should have.
But from a public health perspective, I would suspect, I don't know. I would suspect that the goal would be to handle marijuana along the lines of liquor, of alcohol, to kind of handle it in some kind of a segregated retail setting.
Yeah, absolutely. I mean, I think, and different states have done this different ways. And, I sort of, from the public health perspective, the most control you can have is to have a state monopoly. So only state-owned and operated stores
There's some
can
states
sell.
that have state liquor
Some
stores.
states have
Right.
state liquor stores, and I
Right.
think Washington State actually adopted a state monopoly policy when they legalized cannabis. So I think that's, there's that. That's obviously probably not happening here because we don't do that with alcohol, right? That's already.
We don't have state. We have state licensed liquor stores.
That's right.
but
So
not
then the
state
next
liquor
thing
stores.
is licensing. So licensing then, how do you monitor licensing? So, everybody who files for a license with the state liquor authority has to, there are background checks and then there are limits on how many licenses you can have in a district.
It goes through community boards.
That's right, and
Right,
it goes.
right,
However,
right.
I
Just
think
advisory.
and what's really important, though, you brought up the corporate influence, which is really key because we've seen a real erosion of the original intent, for example, of alcohol beverage control acts and legislation. I mean, post-prohibition, there was actually a real attempt to promote moderation. That's what it was called. I mean, it was this idea of how do we moderate alcohol consumption since we failed in prohibition. And that's been continuously eroded by sort of corporate influence.
But it's the same philosophy with marijuana, is that we failed in prohibition.
That's right. But how do we prevent corporate influence? How do we prevent that creep? And I think that's, the challenge. I haven't been following Albany, on this issue very closely, but I think it's always a challenge to get all of that stuff in a really solid, comprehensive bill. Exactly.
Well, in terms of like licensing, actually, if you have a state liquor license, you won't be able to sell marijuana. So that
It
actually
seems strange to me.
your local bodega owners who might want to add that to their their shelves, they won't be able to. So if you'd want to sell it, you'd have to either not sell liquor or like alcohol, or just open up an entirely new store, which might not always be super feasible for communities of colors that have been disinvested in, and might discourage people from trying to open up a business that sells it, and might encourage more kind of corporate chains. Yeah.
Right.
I think my frustration too and I was a former assembly member, so I know how Albany works, pre this Democratic led in both houses. But my frustration with pushing this through as a budget item is that it only looks at it as a revenue generator, and that's the wrong approach. We're talking about changing the lives of New Yorkers, the environment by which we work, and cannabis legalization is a real issue. And I don't think it should be bunched into a budget conversation by April 1. It's
The big
not
ugly. You
it's
shouldn't
not
be in the big
acceptable.
ugly.
And
The
then
big ugly
Right.
is what happens in the last 12 hours of a
Absolutely.
state
Big
legislative
ugly.
session.
You put everything in
You
it.
put everything
I
in,
think that's
in the
wrong.
pot again.
Totally thoughtless. And how, I still don't understand. Do we know right now what, I thought we were in a decriminalized state. And I don't, and there are people who are pushing for decriminalization, sans legalization, who are saying that the only reason why there's now a push to legalize is because folks can't, the big corporations can't make money off of decriminalization. They can make money off of legalization because, well, I don't understand.
Well, the
What is the
other
state of affairs
the
right
other-
now in New
the
York?
other side of that argument is that you now have a gang culture across large parts of this city, which are based on getting money by dealing drugs. Whether it's, you know, I mean, to some degree they're dealing harder drugs, they're dealing heroin, they're dealing fentanyl,
Yep,
you know,
fentanyl,
they're
yep.
dealing opioids, but they're also dealing marijuana. And so, you know, part of the argument is you replace, you still have a health problem, you still have a social problem, you minimize or lessen the criminal problem.
No, but Bob, I'm asking, what is the state of affairs right now?
This-
I just heard Alex Berenson, who's written a book called Tell Your Children, which is where he's linking marijuana to schizophrenia in teenagers. He's a New York Times reporter who didn't start off without an agenda on this. People are slamming him for bringing back reefer madness. But the fact of the matter is that he's saying that very few people are going to jail for marijuana possession. I honestly don't know what the state of affairs is in New York.
I don't know that they're
in
going to jail anymore,
2019.
but they are certainly getting a criminal record. So, go ahead.
Yeah,
Depends on what county, honestly.
it depends on the county. It depends
Honestly.
on the, you know, really I mean, truthfully, we still have discretionary policing, right? We can't. That's never going to change.
That's
you
never
know, you're
going-
talking about human beings, so that's very real, and we have to be cognizant of that. But I think, as I understand it, it's decriminalization for possession of less than an ounce. Yes, less than an ounce. I'm seeing nods. But that is in your possession, right? So, because that's considered for personal use, but that is not in public view. As soon as it's in public view, which was the distinction that had to be made, which is what people being asked to empty their pockets were then suddenly hit with, okay, now it's in public view, now I can hit you with a criminal charge. Otherwise, it's a civil infraction. So it's like a ticket and a fine. So perhaps few people are going to jail for possession. There's definitely, I mean, there is a lot of attention to sort of monitoring how that change actually, the law was already on the books. It just wasn't the law on the streets, right? The law on the streets was empty your pockets, or it was, I think I smell it, let me, you know, or empty your car, whatever. But I think that that's more than, and you know, I would sort of dispute that it's necessarily like a big criminal enterprise in a, you know, what we need is social investment, right? So what we're saying is like, let's move this into the public realm, and then let's talk about social investment, as you're talking about. I mean, communities
talk about
have been
treatment.
hit hard. Let's treatment. Let's talk about addiction too, because I think what's important also is we know that not everybody becomes addicted to a drug, right? As you said, some people could use when they're
Many
a teenager and then not develop a problem. So who gets addicted and why? And we know a lot more now, I think, and we're learning to put that into practice. So how do we practice that? How do we have early intervention for mental health issues, for example, so that they don't develop to become, you know, how do we have trauma-informed
Well,
care? How do we address, you know,
Yes.
the root
There
of
was a
addiction?
serious concern, I know, in the treatment community about what the effect was on marijuana on the teenage brain, which is different from the effect on your brain, which is, for better or worse. But my point is that if there is ambivalence about use, there was a point in time where there was a clear no-use ethos, if you will, for teenagers, right? And now it's not even about smoking. It's about vaping. It's about taking Juul.
Yeah, but that would still be the case.
So there's,
Correct me if I'm wrong, but you're still talking about you have to be 21
Yes.
in order to legally buy marijuana. So
Yeah.
I mean, that teenage problem will not change.
Well, no.
except that their older brother will be able to buy it for them.
and I'm not,
black market, too.
Not from the black market.
well, and I'm not wedded to
I
any
understand.
point of view. I'm just saying that according to the folks, you know, there's a guy named Ken Sabat who runs something called Smart Approaches to Marijuana. He's hooked up with Patrick Kennedy and some other folks, and they're pushing for decriminalization. And they're saying that in the state of Colorado, the number of 12-year-olds to 17-year-olds reporting first use of marijuana in legalized Colorado is very high.
Higher than it was.
Yeah, and I don't know the exact numbers on this. And then, of course, when I look at that, somebody says, that's not true. That study is debunked.
Yeah, I've seen the opposite reported too. So there's a lot of dispute around this stuff still, I think. And I mean, it's become this whose science do you
But my
believe?
point is, at what are you willing to risk on all this stuff that's unknown? I think you and I would differ in terms of you say in a non-criminal situation. I'm not for the illegal use of what's happened in the criminal justice system was never intended by the treatment world, but it was clearly a profound effect on a generation of mainly minority males. And that is something that the treatment world never was interested in accomplishing when they were talking about you can't legalize drugs. But they were saying that the criminal justice system was a way to get folks to treatment. Too many folks never got to treatment and they stayed in prison. That is a
Well, a lot of
truth.
people don't get to treatment and when it comes to opioids, they die. So,
well, the whole opioid situation, I mean, we had 70,000 fentanyl deaths last year.
No, overdose overall. 49,000 involved opioids.
Death.
Some of that was fentanyl, a fair amount because that's what drove it up. I do overdose in my day job.
No, but it's a serious number of.
Yeah, absolutely.
It's tens of thousands of
is
folks.
there a slippery slope argument? Because there's essentially a libertarian quality to this argument, an anti-prohibition argument going on here.
But
That
see, that
prohibition
doesn't have to be
work, so
libertarian.
let's legalize. Is that the same?
But that doesn't.
I mean, is there a slippery slope to other drugs being legalized?
I mean, I think that, in any rational system, you legalize based on the relative harm of the substance, right? And the relative harm of opioids is clear, right? I mean, we know people now are, overdosing who are maybe what you might call a recreational user, but because of fentanyl, opioid use, you develop a dependence that actually puts you in physical withdrawal, and dependence happens pretty quickly, physically. So I think, if we wanted to talk about a legalization scheme, which I don't think we're going to talk about tonight, that would take us way off into it.
Yeah.
But I mean, you would want to be able to talk about it through the lens of relative harms. I think going back to this question of, is legalizing going to increase youth consumption? I mean, you speak about, the community and how young people view cannabis at this point. I mean, I think I'm much more worried about how young people view pills, first of all, because I think pills are everywhere, and young people have been maybe overprescribed pills that are like stimulant pills and see pills as an end, which is there you go to the opioid problem. With cannabis, just like alcohol, I mean, how do we manage? I mean, if you have to get your older brother to buy you alcohol, versus going down the block and being able to buy a bag on the corner, right? I mean,
This is going back to your question earlier on about, are we talking about a world in which marijuana is marketed and sold so that are we going to have big marijuana the way there was big tobacco?
I mean, we
and
could
Lou
put
Reed, Joe
restrictions on
Camel?
that.
We can.
We can, and will
is that what legalization looks like? I don't know what legalization.
Well, I mean,
It's every state is different, and you do have large companies, but it's sort of impossible to tell until you kind of can take a broad look at how companies are approaching it, and I think that you will always run a risk that it will be marketed in such a way, but. In New York, I believe there's legislation now to, change the marketing and packaging for like Juul cigarettes so that it's less appealing to kids and to
This
teenagers.
is a huge problem.
There's moves to control menthol, to control
K2.
flavors,
We had
right?
a big issue
right.
with K2 a couple
Right.
of years ago. I think I'm more concerned in New York City, as I mentioned, that it's the the discretion that police officers have, and depending on what borough you're in, how much marijuana you have on you, the police officers have the discretion to arrest you based on how much you have on you in terms of possession, your past record, and then every district attorney in New York City is so different, and everyone has a role to play. I've met a lot of parents in my world as a council member whose children were affected by opioids because they had an injury and they were prescribed pain medication, and then they were stopped on that pain medication, and then they got addicted to opioid because I never understood how you got that addiction. And so a lot of times it starts with something very small, and if you're exposed to it. I agree, and I admit that everything we do, there's always unintended consequences. So while we try to do the right thing, we have to understand that there are consequences that will happen as a result of what we're doing. The black market that could surge through this. I think it's a good idea to regulate something because you provide guidelines, you provide structure, and I'm very big on consistency. It's really a challenge these days with 5 district attorneys, and out of the 5, Manhattan, Brooklyn, and the Bronx are the only ones that have decriminalized marijuana where they're declining to prosecute cases. But if you're in Staten Island, you may get arrested, or if you're in Queens, you may get arrested too. So to me, it's about consistency. It's about having the same conversation and making sure that everyone is on the same page and not doing it in the budget season. And it can't happen during that time.
The thing with regulation too is that the Senate sponsor Liz Krueger once told me that the way that she sees it, the medical marijuana program has always been fairly restrictive. The new legislation wouldn't necessarily change that. It's still pretty, a finite list of conditions that you can get a card for. Liz Krueger, she told me one time that the way she sees it is, if people are going to be smoking it anyway, and if they're going to be using it to, calm their nerves, if they're going to use it, for, medical issues that they can't get a prescription for it, that it's much safer if they can go down to a store and know exactly what's in it, exactly the dosage, so that it's regulated. So, it's more like if people are going to get to it anyway,
Right. You might as well regulate.
it's better to make it safe for people.
Well, the argument that you
So
might
Cy
as well, the argument about you might as well is reflective of the general perception that had, just as with same-sex marriage, that it was this total taboo, and then there was a rush to justice, frankly, if you'll pardon my expressing an opinion. This was totally a non-issue, and ever since 2012 with Colorado and Washington, there's been this rush to legalize it, in part by state governments that see dollar signs. I mean, part of this is, but it's
And that's
also,
the wrong reason to do that.
But it's also, I believe, a sense, kind of a growing awareness of the failure of prohibition as a means to control it. I don't think that legalizing recreational marijuana means that the state is promoting the use of recreational marijuana, but that's the perception among a lot of opponents.
And perception and reality is very different.
Right. But I would say, you brought up, is this a libertarian? Are we, heading down it's a libertarian move to legalize. And I think that, that's really key. What, you say it's better to be able to regulate and know what you're talking about. So, again, going back to this, I think what gets lost in the fight over the bill and the bill language and then the revenue and all these is the actual, how are we going to regulate this? Truly, deeply, are we going to leave it to a state authority that is maybe then can be influenced indirectly, directly by a corporate lobby? And how are we going to deal with that? And I think those are unanswered questions, because we have the same problem with alcohol, the same problem with tobacco. We are already dealing with that. And so what can we take from that experience? I don't have a good answer, except to think about the very specific, can we set a minimum price? Can we set a maximum potency that's ever available? Can we set a taxation, package?
It was even pointed out to me that, if you're stopped and you're suspected of driving under the influence of alcohol, they can give you a blood test, they can give you a breathalyzer test. Marijuana, the active ingredients of marijuana stay in your system for a long time. You can't do a blood test that'll tell you I was stoned, when I was driving. So there are actually some technical police complications.
It's also much harder. You can stop someone on the street, give them a field sobriety test, do a breathalyzer. You can know right on the spot, as opposed to with marijuana. in some states, it's kind of started to clog up the courts. You know, it takes time to do these blood tests and urine tests, and it costs money, and there's no definitive way to know whether or not they were actually intoxicated, if they had just, you know, had, you know, smoked some
Something
marijuana from you know, a couple
could be
days
5
ago.
days ago. Right.
And there's no, really, some states will have, you know, a cutoff level where if your blood level is above X amount, that, you know, it's illegal. Some have no tolerance at all, zero tolerance policy, but, you know, everyone else reacts differently. The way that you ingest it will also affect, you know, how you're
Whether it's an
affected.
edible or smoking.
So, you know, it's the road safety aspect of it is probably one of the biggest issues that, you know, opponents who say maybe we should slow down will point to, because in states where it's legal, they've noticed an increase in traffic deaths where the driver had, you know, THC in their system. Now, whether or not that's a direct correlation, you know, it's hard to tell, but it's, you know, a concerning figure nonetheless.
Well, my understanding is
That's
that
the NYPD's position. They're very
again, we
concerned.
live in a world of conflicting facts. But my understanding was that in Colorado, there was an increase in traffic fatalities where there was no other substance besides THC in the system. So this isn't like drunk driving. It's like
Well, I think there was an increase in both, where you'd have THC and other substances, but at the same time, you know, it's hard to tell. Well, do they crash because they had just smoked, or are there just more people smoking who have it in their system who happen to get into a crash?
Do we have that
mirror an
ambivalence
overall
about
population
do we have that ambivalence about alcohol?
Well,
by the way?
alcohol doesn't have the same effect. Like, you know, if you drank alcohol a day and a half ago, it's not going to still be in your system, as opposed to THC. If they find it in your system, they have no. A lot of these cops, they don't have a way of saying, well, this level is too much.
I got
they
you.
just
I got
see
you.
that you have THC in your system. You might be
One
high.
of the
It's hard to know.
One of the NYPD and other police. But
Absolutely.
let me take a question. Tell us your name and your campus.
Hello, everyone. I'm Timothy Giral, and I'm from York College. My question goes to the decriminalization aspect of it. Now, if you legalize marijuana, and there's still going to be other people out there on the black market, like you said, selling marijuana. Now, would that increase the level of decriminalization, or like basically would they have a higher basically if you're selling weed and you're on the streets and you're not doing it businessly, are you going to get in more trouble? Than now?
I mean, the question
So
is
it contradicting it?
Well,
Or
if you sell, if you have a still, if you're a moonshiner, and you know, and you're,
Showing his
and
age
you're-
yet again.
Right. I'm not a moonshiner, and you know, if you undercut the sale of legal alcohol, you can be arrested. If you have a legal marijuana, and if you tax it at such a level that it's kind of that it's too expensive, will you still have a street sale criminal culture?
Well, there will still be, you know, it'll still be illegal to grow in your house. It'll still be illegal to sell without a
I
license.
thought that you were able to do. You would
Grow
be
for
able
your own
to
use.
grow a number of plants.
Only medical. Only people with medical
Oh,
cards
is that right?
would, well, under Cuomo's legislation. I
Yeah,
honestly am not sure.
I know some states
about,
you're allowed to grow 2 plants or something like that.
in some states, a lot of, you know, people, advocates, not advocates, but, you know, it's generally agreed upon among as experts, is my understanding, that that's not a good thing. It's hard to regulate, and then you have the risk of people then selling it, and, you know, it's hard to know exactly how much people are growing. And even though advocates, you know, are saying we should be able to grow it in our own houses, I think that could lead to a slippery slope where it's harder to regulate because it's in personal houses. But there would still be criminal penalties for you know, selling without
it
a license.
outside the regulated system.
Off the top of my head, though, right now, I can't remember whether or not. I believe it might be a slightly less penalty than it is now, but I can't say that with you know, certainty. It's something that's kind of buried.
I mean, talking
in
about
bill
the
language.
price, I mean, one of the issues is the level that a locality can add to the sales tax in order to collect some degree of revenue in order to offset what they argue will be their increased costs in regulating it.
I mean, and the flip side is we've seen with cigarettes how that kind of backfires because you do have an illicit market, right, for cigarette sales. And so,
Coming up from North Carolina and stuff.
yeah, and so, I mean, it is this challenge, and I think there is a delicate balance, and we have to think about how we criminalize people fundamentally, because that's, you know, a goal here is decriminalize people.
Yes, ma'am.
Hi, my name is Elisa Crespo. I'm a student at John Jay College. I have a quick comment. I hope that when this does pass, if it does, that there is some sort of restorative justice aspect to it. I think that's really important. But as we speak right now, there are thousands of people smoking marijuana in New York City and in the States.
If you walk down the street, that is true.
This is
Spotted on my way
it's
here.
happening, it has been happening, and it will happen. It's not going to end. If we can legalize cigarettes and we can legalize alcohol, which we know actually does result into fatalities, why is this even something that we are speaking about as if it's not, you know, inevitable?
Well, it wasn't up until very recently. So, I mean, I think what you're saying is that, I mean, this is an idea, just the fact of legalization of recreational marijuana is like mainstream, which it was not. Why, why hasn't this happened?
Well, I think that there are so many layers to this, and even when, you know, alcohol was legalized, it wasn't the easiest thing to do, and it may seem like, you know, it was easy, but there were a lot of layers in place with the state liquor authority and certain licenses you have to go through. But legalizing marijuana, to me, is very complicated because there are so many parts of this. The public safety aspect, the public health aspect, the medical professionals, those who are actually going to distribute the product, how much, the volume, the possession, the law enforcement, the prosecution. I mean, there are a lot of faces when you talk about this, and there are a lot of different opinions. So I think it's something that we should be talking about because, as it was mentioned, it is happening all the time. But I am really of the mindset that in order to reduce the black market, reduce all the illegal things that have been happening, the disproportionate impact it's had on communities of color, we have to move towards regulation. And we have to move towards it in the right way. And I've said in a community like mine, where my seniors hate it and then the younger generation loves it, we're going to find a medium and a balance. Because at the end of the day, we want people to do it in the right way where they can be safe. It's just like the safe injection sites that we've been talking about in New York City, where we're trying to look at locations where individuals can use drugs legally and safely.
Well, no,
very controversial.
It wouldn't be legally, but it would
very
be safely.
controversial.
Right.
Safely.
And quite frankly, it just goes back to the perception, which goes back to when it was originally, you know, the federal government decided that would be a Schedule I drug, and that also goes back to actually the industrial use of cannabis. You know, it's a very versatile plant, and you know there are a lot of big industries who
use hemp,
and they didn't want it to be legal, so they lobbied the government to say, you know, this marijuana plant, it's bad, you should make it illegal. And though that's decades and decades of you know, fear mongering, whether it's true or not, and you know it's really affected how we can you know, objectively study the effects of this drug. So you know it's like the balance between wanting to take this, you know, comparatively safer drug as opposed to, you know, alcohol or maybe cigarettes, and wanting to just make it legal, and then having to you know, go back to the fact that it hasn't been studied, so we don't really know exactly what the effects are.
I agree with that. And I also think that what happened, the reefer madness thing, there was such a blowback against that because that kind of hyperbolic, you know, rhetoric wasn't jibing with people's experience. But there are serious people who are very concerned about the science of marijuana that it's not, when people say it's safer because you're not crashing your car, well, we don't know because it's not. Let me slow it down. There are serious people talking about connections between marijuana and mental illness and marijuana and other social ills, which I don't know if they're right, but I think that when we start talking about the idea of marketing marijuana, it sounds to me like, oh, we're making another stupid mistake in plain view of ourselves.
So how about we ban, I mean, this is the problem. You can't ban because corporations are people and you can't limit their free speech. But how could we limit marketing, really? Because we shouldn't. I mean, we were the last subway system in the country to allow alcohol advertising on our subways. I don't know if you noticed recently, finally.
No, I didn't.
It was about maybe 5 years ago now. We finally got rid of alcohol advertising on the MTA. But, I mean, you think about that, kids every day taking the subway to school and looking at like a whole subway car full of whiskey or Budweiser, right? So how do we limit marketing, like radically limit? How do we, make packaging plain and, with a warning label, nothing
Well,
cute?
you could do
Yeah,
what
like
you did with tobacco, which in which, at least in this city, because I'm familiar with it, I did some work with the tobacco-free people, is severely limits advertising in your local store and
Right.
keeping things out of
Right.
behind counters and stuff.
Right.
I want to go to a last question, but I do want to ask you: is there any rational reason that marijuana at this point is a Schedule I drug on the federal level?
No. I mean, simple answer to that, no. Schedule I, no medical. Schedule I means risk of abuse and no medical value, right? I think there has been acknowledgement now. Medical marijuana happened, not just through social movements and advocacy, but because there are real patients who've experienced
palliative
real
reason,
benefits
right.
from, that's right. So that's what Schedule I means. I mean, opioids, prescription opioids are Schedule II, right? So, I mean, Schedule II means there's medical benefit. It is used in some cases for medical benefit.
Is
right?
there a
So-
lower criminal penalty to a Schedule II than a Schedule I? I don't know.
No, it's not associated with the penalties happen separately. I mean, they happen at a separate place. I mean, the point is you can't do the research, you can't use it in medicine, you can't, that's the problem with the schedule.
Yes, sir.
Hello, good evening. My name is Justin Freeman. I'm from LaGuardia Community College.
Oh, nice.
I've had a look at the marijuana Regulation and
Act.
Taxation Act, and one of the statistics that I thought was interesting was the 100,000 people that were arrested in 2014 for having marijuana less than an ounce. And I guess one of my questions is, what is the police thinking about this? How does this affect funding for the police, as well as prosecution within the United States, the judicial system? And are they speaking out against it? And another question that I have is regarding the reentry programs. Considering a lot of these people that got arrested are showing, marginally or in some cases a lot of entrepreneurial skills. They're able to sell marijuana, make money, provide for their family. Are the people that are incarcerated or formerly incarcerated being put into entrepreneurial programs and have first dibs into the
It's a
marijuana
restorative
Yeah,
justice
equity
coming up
lens
and
and a
things like
restor-
this?
yeah.
I was always amazed by the kids in the program who had flunked out of school miserably, and yet while they were dealing on the streets, they had the most complicated systems for how to, in a way that was, I could never have pulled it off. And when you thought about the danger of this and the danger, so there were very talented kids
Calculating.
who were the failures in the education system and had just dropped out completely. But it was always amazing to me when we talk about street smart. I mean, it was.
Yeah, but I think part of what the question goes to is the issue of expunging the records
Yep,
of people. I assume that just as with liquor, if you have a certain criminal background, you're not going to be allowed to sell liquor. If that's the case in marijuana, when you have such a disproportionate arrest records into communities of color, you're like taking all those people out of the equation, and that's where expunging a record comes in.
So I think there are certain conditions that elected officials have said have to happen in order for this to be supportive. You have to be able to expunge records. The records need to be sealed. Community reinvestment has to happen in the communities of color that have been most impacted. And I believe, the marijuana dealer can be the entrepreneur the next day. We have to allow an opportunity for the same young adult adults that have been incarcerated and arrested by marijuana possession to now use that in a positive way. There's nothing that precludes us from doing that as long as we all have the right mindset. What we run the risk of is having the big ideas like using the $1 billion of projected revenue for our mass transit. I mean, again, it's an idea, and I just don't think it's the right course of action. It sends a horrible message, and this is some of the reasons why we get pushback. I am very concerned. I know the NYPD has a lot of concern because they are just truly, genuinely concerned about drivers and the impact that marijuana will have on that. And we've done so much work around Vision Zero to reduce fatalities and crashes throughout New York City to protect, New Yorkers, that we really don't want to go down that road again. So I think it should be reinvestment, record expungement, and making sure that we turn those, negatives into a positive.
I want to try to get one more question, and we have 2 minutes left.
Hi, my name is Navjot Kaur. I'm from Baruch College. And my question is there consensus between the medical community and the state legislature regarding marijuana laws? Because I believe that, I was wondering if the Medical Association has spoken about the marijuana,
I don't.
proposed
I mean,
marijuana law.
Have they signed on as the
I'm
State Medical Society supportive?
Go ahead.
Question.
Quickly.
I'm not entirely sure to what extent the medical community has signed on. I know that some of the businesses are for it. I think that I'm not sure if there is a broad consensus. I know that there are advocates for the medical marijuana who would rather see fixes to the program that's currently in place before they see recreational marijuana because, funny enough, there's been legislation to make changes to the medical marijuana program that has never passed the legislature, and it's looking like this recreational marijuana legalization will happen
Quickly.
before.
And I just want to say quickly that there is an appalling lack of treatment certainly for publicly funded treatment for teenagers in this state, for example, for substance abuse. And that is a huge problem that somebody should try to figure out.
Right, and currently, yes, treatment.
And I think the concern in the treatment community is that if it's easier to get marijuana, that could exacerbate the need for that kind of treatment.
And how do we bring treatment out into the community, outside of the clinic walls too? I think treatment is undergoing some changes and could undergo some more to be more accessible and more widely kind of available to people. Yeah.
We only have 10 seconds left. I want to thank everybody. This is a debate that's going to be focused on before the end of the legislative year. We'll see what happens. Thank you, and we'll see you next time on CUNY Forum. Thank you.
Thank you.
Thank you.